Okay, wow. So what a great start. Such a load of really interesting and informative information there from Elaine, and a load of resources and work going on in the Northeast. I know I'm really keen to find out more. Okay, so let's move on now. Our next speaker is Professor Angela Alexander. So Angela is an Emerita professor at the University of Reading. Angela has an MSc and a PhD in the field of pharmacy. She's got 2 further MScs in educational and social research methods and in earth science, and an MA in Shakespeare and theatre. Angela has received an MBE awarded in 2008 for services to pharmacy practice, education, and the voluntary sector. So Angela has been calling for sustainability in education in pharmacy for more than 10 years. So she's really dedicated to this cause and has a great deal of experience in this. Her presentation today is going to look at how aspects of sustainability and education on climate change can be integrated into the General Pharmaceutical Council standards for the initial education and training of pharmacists. Okay, Angela, over to you.
Okay, thanks very much, Nuala. I guess you can see the slides okay, yes?
Yes, we can.
Right. As Nuala says, I've been around quite a long time. I've been in pharmacy for over 50 years, and I was born before plastic. Well, I don't think I was born before plastic. It was probably invented before I was born, but it certainly wasn't used before I was born. So I remember when all our fruit, all our vegetables came in paper bags. I still have my 2 dolls here in my office. One is made of china and the other is sort of hand sewn. I don't know what she was made of, but having remembered a life before plastic and seen the enormous amount of waste that we've generated within my lifetime, I became very conscious of what we're doing to the earth. And that was what prompted me to do my degree in earth sciences. So I did a master's degree in earth sciences, and that really woke me up as to what was happening about climate change. And it was around that time that I first started saying, what's pharmacy doing about this? I wrote in the journal over 10 years ago. I think I got 1 letter of disdain about, nothing to do with us kind of thing. And so I felt a bit in the wastelands, really, with what I was trying to do. So I was really delighted when Pharmacy Declares came on the scene. 1 or 2 enthusiasts approached me, and obviously it's grown into a huge movement now, as evidenced by the conferences that we're having. So that was sort of a bit about where I came from. You've seen these climate stripes before, I'm sure, and they were developed by one of my colleagues at the University of Reading, Ed Hawkins. I mean, they weren't developed by him. They are just a reflection of what's happening to the annual average land temperature, and they reflect the anomalies. So I'm sure quite a few of the younger of you were definitely born in the red, but some of the older of us would have been born in the blue, as it were. And that's where we need to get back to. We've all seen pictures like this of the catastrophes around the world. We know what's happening. It's warming. It's us. We're sure. Surely there can be no climate deniers now. We know it's bad, but we also know that it is possible. We can fix it, but we've only got about 10 years to do it in. So what's happening within the NHS? Well, we're getting a lot of top-down pressures. So we've got the Delivering a Net Zero NHS document. We know where the sources of carbon emissions are coming from in the NHS, medicines, medical equipment, and other supply chain being a huge part of that. And, surely pharmacy needs to be involved, and I'm sure everybody here agrees, because that's where a lot of the emissions are coming from. Again, top-down stuff, we're being told this. We're being told more top-down stuff about the National Overprescribing Review, good for you, good for us, good for everybody. Again, really good to see that published last year and to make that connection between overprescribing and how we can reduce carbon emissions as a result of that. So all of this has been absolute music to my ears after, as I say, feeling I was in a bit of a wasteland for 10 years. We're getting stuff coming up, well, will be getting stuff coming from the bottom up as well. So this is NICE's recent proclamation, really, on their decision aid on asthma, inhalers and climate change. So this is wording for patients. So this is explaining what the decision aid is about to patients. And I've just highlighted those parts. points out to patients everyone has a carbon footprint. If you'd like to think about reducing yours for your asthma treatment, it explains the options. And then it goes on to, you know, don't stop taking them without talking to your healthcare professional, the usual stuff. So as healthcare professionals, we're going to be getting patients asking us. We need to be prepared. We need to be able to have those discussions. It's also, the environment has crept into part of the pharmacy quality scheme for community pharmacy. This has just been republished. So this is from October. There's a respiratory domain, and it says there that all patient-facing pharmacy staff have to have this training on, and I've just highlighted the parts, adverse effects of the environmental aspects when inhalers are disposed, and again a little bit more about how we have to have discussions with our patients. So we don't just have to know about it, we've got to talk to patients about environmental impacts. Admittedly, this is just on disposal, but I think if you're having those discussions on disposal, you really need to be talking about carbon footprints too. So again, top-down stuff, telling pharmacists what we should be doing. This was mentioned, I think, by Nuala, about how it's also incorporated into the competency framework for all prescribers, and this is all prescribers. I actually chaired this working party, which is probably why this statement's crept in, but that aside, it was well represented by all the prescribing professions, including medics, dentists, nurses, allied health professionals, and we have this statement, this competence that you have to, and this is put into 9.7, consider the impact of prescribing on sustainability, as well as methods of reducing the carbon footprint and environmental impact of any medicine. So it's there for all prescribers. So as pharmacists, we need to be supporting all prescribers to achieve that competency. There's a little note at the bottom that tells you how it can be done, you know, disposal, recycling, avoiding overprescribing, etc., deprescribing, dose optimization. So the RPS has gone into a little bit of detail there to help us. But again, top-down stuff, really. I also think we have to think about the business aspects. We can't just focus on the clinical aspects. There will be business implications as well for us all to think about. And my two little pigeons here, obviously there are some downturns. Climate change is bringing about changes to primary production. It is causing disruption in the supply chain. We've already seen that. There are catastrophes around. Flooding in the UK we've seen, which prevents normal operations of pharmacies. People being taken out of their homes, obviously maybe not having their medication with them, so pharmacists have to come in and help out with those catastrophes. We're already seeing that downsized, but we need to think of Professor Pidgeon here. He's saying, well, there's always the opposite of a downturn, so you've got to think about what we can do from a business perspective, where it will increase business, where there'll be betterment, improvements, expansion, development. And that led me to looking at a little bit about consumer demand and the Nielsen study about sustainable shoppers. So 73% of consumers would switch their products if their choices had a more positive environmental impact. Goods with brands with demonstrated commitment to sustainability outperform those that don't. And consumers are willing to pay more for natural and organic ingredients. Now, I don't know when you last walked into a community pharmacy. I did yesterday. Still rows and rows of plastic. You know, everything is in plastic. I couldn't find, I mean, I use shampoo bars and things. I couldn't find those products in my local pharmacy. I couldn't find reusable, resustainable products in the pharmacy. There was single-use cotton wools, things like that. So we've got to, from a business perspective, be prepared to address this. So this is what I'm really here to talk about, sustainability in the MPharm. That was really just setting the scenes. Now, the document on the left is the standards for the initial education and training. This has relatively recently been published, January of last year. So it's unrealistic and and in fact now I've realised unnecessary to expect new learning outcomes to be produced by GPHC. I worked for the GPHC in the past, and for the last, I think, 2 iterations of the standards for the education and training of pharmacists, I have asked them to include sustainability. They have said no, or at least haven't done it. They've said they'd look at it, but it's never happened. And this is the 3rd iteration I've sort of seen when I've been thinking about sustainability, and again, nothing there. But I've come to the conclusion it doesn't need to be there, because it should be everywhere. It should be integrated. It should be embedded everywhere within all of our learning outcomes. We need this new systems thinking approach to see how everything we do is connected, and it's connected to the whole entirety of the population, so that we can have health and a healthy planet. And as I say, the pharmacy declares, the rise of pharmacy declares was just wonderful for me. And out of our initial meetings, when I think there was just 4 of us who probably met on the first Zoom we ever did, since then it's grown exponentially almost. We now have an education group, and the Pharmacy Declares Education Group is a mix of practitioners, academics, students. So we've got all of the population that needs to start to think about this. So what we're doing is we're developing a draft document to show how sustainability can be integrated into every single GPHC learning outcome. And we're including examples of different teaching approaches that could be used, different resources that could be used. The first draft was sent to GPHC over a year ago now. I regularly follow it up with emails, which is getting somewhere. So the latest I heard was that GPHC were in discussion with Pharmacy Schools Council on how this draft document and how this incorporation of sustainability and this integration. I mean, we talk about an integrated MPharm, but we talk about it from a clinical perspective. We haven't really yet been talking about it from a sustainability perspective. And that's the conversation I want to hear happening. So I've just grabbed, I only added this slide recently. So it's definitely work in progress. But this is just a quick copy from the Word document I pushed in today, where I've taken all of the 52, well, I shouldn't say we, because lots of people have contributed to the draft document, and it's undergoing changes now, so keep an eye on it. So for every 52 of the learning outcomes, we've got another column with suggestions for how you could incorporate sustainability. So I mean, the first learning outcome, demonstrating empathy and keeping the person at the centre of their approach to care at all times. Well, part of that empathy will be recognising that the climate and ecological emergency will impact on patients. We've already seen those statistics about how some of the younger people are terrified of what's going to be happening to the climate. You know, so we have to have empathy for their feelings on that when we're talking to them about climate change. So as I say, that was just a quick screen grab to show you what we've been doing. The other piece of work is looking at the Education for Sustainable Healthcare, the curriculum for the UK, which has been mentioned, endorsed by the Medical Schools Council, and I've put the link there. There's also a Pharmacy Declares Education subgroup who are working on looking at this document and thinking about how it's relevant to putting sustainability into the pharmacy curriculum. And again, this is something that we hope will be endorsed by Pharmacy Schools Council with the aim of publication on Earth Day in 2023 on the 22nd of April. So again, a different approach. GPHC have always gone down the learning outcomes approach rather than saying we have to have a certain curriculum. But I think if we can support pharmacy schools to look at this curriculum and think how it applies to pharmacy, it just sort of adds to the whole picture of what's needed. This is my brick wall. So far I've been quite positive about where we're going and what's happening. but we are going to hit brick walls. It's not going to be easy. And I tried to think about, well, what are the problems we've got with this brick wall? So what are some of the barriers? There's definitely going to be institutional inertia. Although I think that's changing just over the last year. I think universities have realised, I think everybody's realised, all organisations are beginning to realise that, you know, we've got to do something about climate change. We've got to do something about this crisis that's coming. So I think the institutional inertia probably now will be less than I faced 10 years ago. There are curriculum constraints. The MPharm, and I'm sure all the students on this call will realise there's a lot to be packed into an MPharm. So how are we going to get, we don't want a whole new module on sustainability. Well, it's not what I want. Some universities may go down that route. We just need it to be mentioned by everybody everywhere. So it's there, and you're, as a student, you're constantly thinking about where in the curriculum can it go. But there are curriculum constraints. Thinking about colleagues, there is probably, was a lack of pedagogical expertise. Again, I think that's changing now. Universities, we have standard training that we have to be put through, or, you know, as I say, it sounds as though we don't particularly want it, but, you know, the sustainability, I think, will be there in the future as part of how do we incorporate sustainability into all of our teaching. And there have been accusations of doom mongering. You know, people say, oh, you know, it's bad enough, we hear about it, we read about it in the papers, we see Attenborough, you know, harping on about it all the time on the TV. Why do we need to introduce it into our student curriculum? Why does it need to be there? But again, I think all of these barriers, I think we are sort of hitting a bit of a change, and what we've got to start to look for is to think not about the barriers, but about the enablers. What's going to help us up and over this ladder? Well, as I say, the Pharmacy Declares education group there is there to help you. There's definitely student demand, and I'm pleased to see we've got a lot of students on the call today. So you are the future. You are the ones that need to be enabling this to happen. You need to be pushing your academics to, you need to be questioning them on every lecture. You know, where does sustainability fit into this? I know, you know, you may get pushed down at times, but keep at it, keep asking. There's a lot of potential for interprofessional projects, and this is something that, again, has to be there in the MPharm now. We've always been looking for what projects can we do with our other healthcare professionals in the area, with our other social care professionals, with all sorts of different professionals that impact with patients and people. I think this is a huge area for academics to start some really good interprofessional learning for students. We've got the Centre for Sustainable Healthcare, which has been mentioned before, lots and lots of resources there. And I know Matthew's going to be talking to us from a CPPE perspective. There's a huge amount of postgraduate support from CPPE. So what next? Well, I've already mentioned some of these things. So students, you need to be questioning your lecturers at every time about how climate change and sustainability issues will impact on their subject area. And as I say, I think this is every subject area, virtually every learning outcome. I can see an opening for where sustainability could be brought into that learning outcome. If you're a practicing pharmacy professional, you need to ensure that you're up to date and that you can support trainee pharmacists. So you'll have pharmacists on MPharms coming through on placements. You'll have students maybe coming to do summer jobs and things with you. Be prepared, be ready to be able to answer what you're doing in your pharmacy workplace to support sustainability. And when you've got your trainee pharmacists in their 5th year, again, it's going to be a big area there, because they're going to be coming out in the future as prescribers, you know, prescribing ready, I think the term is, isn't it? So we've got that competency that particularly talks about sustainability within prescribing. So you need to be there to be able to support trainee pharmacists in that particular area. if you're in the field of a learning facilitator, or if in fact you're an academic, keep working on this project. If you're an academic in particular, when your MPharm is being reaccredited, rather than wait for GPHC to tell you that you need to put sustainability into the MPharm, tell GPHC how you're putting sustainability into the MPharm. I'm sure they'll be impressed. I'd like to think they'd be impressed. The teams that come to do the accreditation, of which I used to be part of, they're very wired up, and they're very keen people to see the best for students. They're there really for students, I always felt. We're there to see that the MPharms that the universities are providing are what students need for the future. So I think if you are an academic, just tell GPHC what you're doing for students for the future around this area. And I think certainly for everyone, just keep checking the Pharmacy Declares website. There's a huge amount of support materials there. Minna's always adding new things all the time, so I have to keep going back myself to have a look, see what's changed and what's new. Lots of support there. As I say, the draft document for the MPharm learning outcomes is there. I think it's the one, it's about a year old, but I and a few others are working on updating it, so there will be an updated version fairly soon, I hope. So that's about all really I'd got to say. If there's time for questions, I'm more than happy to take them, and ideas. That's where I've got my little ideas button in there. We don't just want questions, we want ideas within our pharmacy education group as part of Pharmacy Declares. What else could we be doing to get sustainability into the MPharm? If anybody wants a PowerPoint copy of my slides, you're more than welcome. I've put my email address there, and please contact me. It's still my Reading University email address. I did retire, I think 6 years ago now, maybe even longer. I have been in pharmacy for over 50 years, but they made me emeritus professor, so I can still use my Reading email address, and it's probably an easier one to remember. So if there's any, I shall stop screen sharing now, and I think we've got a fair bit of time for questions if anybody has them.
We do. Thank you so much for that, Angela. That's really inspiring. And I think I would just like to say thank you for being on this at such an early stage and persisting with it and being that pioneer, because it is so difficult to be that person who's going against the grain. And it's great that obviously, you know, momentum is building now, and there's a group of people working on this, you know, so that's obviously really positive, and I'm sure lots of people will be wanting to get involved in that. And I really like your approach of the kind of the just do it, just get on and do it, and certainly kind of word on the ground. I think schools of pharmacies are just embedding sustainability into their learning outcomes and getting on and doing it, because the demand is coming from the students, and we're going to hear from a number of pharmacy students later on this morning. So to all those pharmacy students out there, I would absolutely echo what Angela has said. You know, just keep asking, keep demanding, and that's the way forward. So let's have a look then at the Q&A. So one of the questions you've already answered. So Minna wanted to talk about how students can get involved or be empowered, which you really answered very well. But another sort of addition to that is how do we reach the postgraduate pharmacy education group? So we're thinking here about there's some universities that will run pharmacy courses, for example, prescribing, but they don't have a school of pharmacy. So there's sort of some little pockets out there that we're perhaps not reaching, and how do we reach those?
I often speak on other conferences for Healthcare Conferences UK. They run a lot of courses about nurse prescribing and for allied healthcare professional prescribing. I certainly think that's a good way of getting it into the prescribing curriculum, to making sure that non-pharmacy schools are aware of it. And it is one of the, you know, this is one of the changed competencies that people aren't that particularly au fait with. And certainly if I'm talking to nurse prescribers or nurse prescribers in training, I always say, find out who your sustainability lead is within your organisation, particularly if you're in the NHS. I'm sure there will be one, won't there? There should be one anyway. Go to your pharmacy, because nurse prescribers just love pharmacists. I'm sure most pharmacists that have interactions with nurse prescribers will agree with that. They say, oh, we'd have never got through the course without our pharmacists. So, you know, be prepared for nurse prescribers in training to come and say to you, I know nothing about the carbon footprint of the medicines I'm going to be prescribing. Is there anything out there? Be prepared to support these other professionals who, as I say, are on other courses. So that's part of addressing it through the prescribing element. I think for the other postgraduate, I think again, it's just up to the students to keep asking. I think we've got to, we know what the top down is, but we've got to push the bottom up to reach that top down point. We've got to be there.
Yeah. And I think that's where the kind of the action is really, the pushing up, isn't it? And finding that tribe and getting together with people who have, are like-minded and working together. And that's a thread that just keeps coming back through, doesn't it?
And I always promote the e-learning for health module, so that's a good sort of intro. And I know somebody in the Q&A had asked, if you're an academic, can you access it? I certainly can. So yeah, if you're an academic, just get a login. I can't remember how I got a login now to e-learning for health, but I certainly did.
So I know certainly because the sustainable healthcare modules on e-learning for health have been created by the Centre for Sustainable Healthcare, and I know they were pushing to have that as open access, not just NHS.
No, that might be why.
Yeah. So my understanding is that is available now to everybody. So a couple of questions for you, Angela, in the Q&A box. So are you able to share the draft guidance for integrating sustainability into the MPharm with this, or is that on the Pharmacy Declares website?
Yes, as I say, the version is there. There's a few gaps that when it was last published we didn't have filled in, and of course it's changing. It's very dynamic. A new document, that latest NICE only came out in October. The latest stuff about the community pharmacy contract has just been renegotiated. So PSNC have only just put their guidance up this month. So it is a dynamic document. So if you pull it off the Pharmacy Declares website now, have a look at it, but certainly go back in a month or two to see how it's changed. And if you've got ideas of, if you're already teaching in your area and it's something we've not thought about within the education group, just let us know, contact through Pharmacy Declares website and we can add it. Because as I say, it's always going to be a dynamic document.
Yeah, absolutely. And we'll be putting up contact details for Pharmacy Declares at the end of the session. And you can also Declares just via the website. So just Google or Ecosia Pharmacy Declares and you'll find it. So a couple of other questions that have come up, Angela, just around general issues. So one person saying, I would assume dosettes are a source of plastic and carbon emission. What are the alternatives that we can use? And another similar one, if we ask patients to bring back all the empty packaging, can it be reused by pharmaceutical companies?
Right. So the first one was dosettes, wasn't it?
Dosettes, yes, being a source.
Well, a simple practical one I saw was if somebody's only on like 2 medications or 1 medication a day, don't send them out with a dosette box that has four options for different times of the day. So that was a simple one. I don't know what the options are really for that one. I know that they're not promoted really, are they? There might be others on this call who could better answer that. And likewise the packaging, and again I think there's other people who are probably better. I know TerraCycle were doing something with Superdrug in the past, but I don't think they're doing so much now. No.
Yeah, I think I've heard very recently that the Superdrug scheme has been withdrawn, which is really, really disappointing. Yes. So similar to the inhaler recycling, where there was a pilot happening in Leicestershire and Rutland in England, certainly there were hopes that would be rolled out nationally, but word is that is not going to happen. So this goes back to what I think Elaine was saying earlier, where we really need to be, pressing the pharmaceutical industry to use some of their great resources and wealth to actually deal with the products that they produce, the packaging, the inhalers, and going back to sort of the principles of sustainable healthcare. Sort of number one is prevention. So, not using things, not consuming if we don't actually need to.
Just going back to my youth, well, my youth as a pharmacist, I spent a lot of my pre-reg year washing glass bottles. We didn't have plastic bottles. Well, we didn't have strip packaging for a start. I forget when that came in, but we didn't even have plastic bottles for medication. Medication was always dispensed into glass bottles. They were returned to the pharmacy. They were reused. They were rewashed. In hospitals, everything was in glass stock bottles. We didn't have typewriters. We had to handwrite the labels. we used to varnish the labels so that the stock bottle labels could be washed.
Wow.
I mean, it was a different lifestyle, but
World.
it was pre-plastic.
Yeah.
It has been done, and it could be done again.
Yeah.
I don't know quite whether that's what we want to go back to, but it could be done. It has.
Well, I think it's about we needing to stop and think about what we're doing. So somebody's mentioned about the excessive amount of paper that's printed when you print off a prescription from the spine. Absolutely.
Yeah.
It used to drive me nuts when I worked in general practice and we're busy doing everything electronically, thinking this is great, no paper.
Yeah.
And then you go into the community pharmacy and there's just reams and reams and reams of paper. So it's about system change.
Yeah.
And kind of
they even used to advertise that as reducing paper. I mean, it's still some of the GP practices are saying, oh, we've got electronic prescribing now, which reduces paper as part of their sustainability. What they don't see is the community pharmacy side. It just shifted the costs from the GP practice to the pharmacy practice. There is one system that works without paper that I saw at the pharmacy show last year, and I've forgotten its name. But if anybody's really interested, I'll try and remember and stick it into chat. There is one PMR system, a sort of spine electronic prescribing system that is paperless. Somebody else may remember. Oh, maybe at the pharmacy show again tomorrow. Maybe, yes, yeah. Matthew, if you can remember who they are. But yeah, one system prides itself on being paperless. So again, it can be done if one system can do it. Yeah, can't they all?
Absolutely. So just one last sort of comment question, asking about the MPharm doc. Is this something that is definitely going to be incorporated into training? And if so, a rough idea of when? So it's Ravijot saying when she last spoke to the GPHC and RPS, they weren't going to change any standards. So what's your sort of...
No, GPHC won't change their learning outcomes. They've only just published them. They've published them for the 5-year course. Published in 2021, only just beginning to take action. They're not going to change in the next 5 years at all. But what will change is, I think, this expectation to see integration of sustainability into those learning outcomes. And that's how I've realised now, that's how it should be. I should have been asking for this 12 years ago when I shouldn't have been asking them to change their learning outcomes. That's where I think I went wrong, working on my own, and I hadn't got this support of a bigger education group to see that it's a whole integrated systems thinking approach that we need.
Yeah, absolutely. Lovely. Thank you so much, Angela, for that that session. That was really inspiring and really encouraging, and great to know that things are moving forward at pace now. And this sort of segues very nicely